Hey, what's up, everyone? So October 10th is World Mental Health Day, and it's as good a time as any to reflect on the state of mental health care in America. When we talk about mental health care, it's important to level set because mental health is such a broad term and encompasses tons of different diagnoses. When we talk about mental health care, we're talking about patients who have been diagnosed with a wide range of conditions, everything from depression, anxiety, bipolar, neurodevelopmental conditions like ADHD, schizophrenia, substance abuse disorder, post-traumatic stress, trauma, obsessive compulsive, and so much more. There's an entire book called the Diagnostic and Statistical Manual of Mental Disorders that psychiatrists rely on to treat patients. And so that's what we're talking about with mental health. A lot of conditions, very broad. And so it's just important to recognize that. When you look at the statistics, it paints a pretty bleak picture here in America. These were compiled by Mental Health America, which is a nonprofit group, and their 2023 report is eye-opening. According to them, 1 out of 5 Americans have been diagnosed with a mental health condition, but more than half of those adults don't even receive treatment. Almost a third, 28% of all adults with mental health condition reported that they were not even able to receive the treatment they needed. 42% of adults said that they have been unable to receive necessary care because they can't even afford it. Conditions like these that go untreated, though, they have a huge downstream impact on the care delivery system. For example, 40% of those suffering from depression are likely to develop heart disease. And there is a strong link between mental health and the prevalence of cancer, diabetes, arthritis, and more. Mental health disorders drive Americans to the emergency room more than any other cause of care outside of childbirth. Now, we all know that the emergency room, that is where the most expensive place to get care in America is. And 12% of all emergency room visits are the result of a mental health disorder. So it's not pretty, and there could be any number of reasons for these trends.
It's really not a good system. If you are a patient with a behavioral health problem, it's almost hard to design a worse system.
Did he just say design a worse system? That was Josh Israel, MD, during his appearance on the Modern Patient Experience podcast. Dr. Israel is a clinical psychiatrist and senior medical director of clinical quality at Aledade, which is a physician-based accountable care organization. And Dr. Israel goes on to explain that there's a few main factors leading to this terrible experience that he points out.
There's a huge shortage overall of behavioral health providers, so it starts with that. And then even within that, those providers who are out there, many of them have found that they can opt out of taking insurance. So there's even fewer available for patients who are trying to get health care with their own health insurance that they've essentially already paid for, often through their employer. If you are somebody with depression, for example, it's just very hard to find somebody to help you. Depression, as we know, especially in more severe forms, often comes with hopelessness. So somebody may already be feeling doubtful that mental health treatment will even help. So it doesn't take a lot to put barriers in front of them to dissuade them from reaching out for care. And then the system goes and does exactly that. They may call 1 or 2 people, they don't get a call back. If they are extra motivated, they may contact their insurance provider and get a list of 20 people and call them all, say, are you taking my insurance? A lot of the time they won't get any calls back, or they may get a call back saying, I can see you in 3 months. It's not a great system, and people will often give up and not go get help.
For every 350 people in need of care, there is only 1 provider, which is completely insufficient. So the pipeline of psychiatrists and mental health professionals needs to improve. And even if patients can find a provider, actually it turns out that most providers don't take insurance. And so that's number 2, which is mental health. It's almost become an entirely self-pay industry. And the expense is one that a lot of patients just cannot afford at all. It can cost anywhere from $65 to $250 for an hour-long therapy session. And most severe diagnoses can cost patients more than $10,000 in out-of-pocket costs per year. $10,000. And so according to White House estimates, about $280 billion was spent on mental health services back in 2020. That's the most recent year for data. But in numerous studies, cost is consistently cited as the biggest barrier to accessing necessary mental health care services by patients. It's not good. And so as it relates to mental health in the workplace, as a result, another downstream impact of mental health disorders and untreated care is that patients end up missing a lot of work. And even if they are at work, they are not bringing their best professional self. This can have huge consequences on patients because a lot of employers, frankly, are not empathetic to employees with mental health issues. And it's estimated that about $193 billion in the United States economy is lost in earnings each year due to mental health. And I've been thinking a lot about this lately. I just had a conversation with one of my coworkers, and I want you to meet Jesse. Their experience working at Access One has made a huge difference for them.
I have had some swings both into mania and into some pretty deep depression while working at Access One. The one good thing about mania is you get a lot of work done. The bad thing about mania is that you will crash, and the crash can be pretty rough. That's one of the things I really have loved about Access One is it feels like I can be open with like my manager, my supervisor about, hey, I'm not doing great, or I just need to take a day or two for like mental health or something like that. And I don't have to lie or try to come up with some kind of more valid excuse for why I need to like maybe leave early that day or take some time off. It was nice to feel like my bipolar wasn't going to make me lose my job, which
Yeah.
hasn't always been the reality.
For
That's why it's really important to like get as much stability in your life as possible. Want to Medication is not the only answer, but it is what has worked for me. So I found stability through medication and then also through work. Having a stable work and life balance is really important, and Access One has really given that to me.
So listening to Jesse, it made me realize just how underrated having a caring and empathetic employer, a caring manager that accepts you for you and provides psychological safety really is for people being treated with mental health conditions. But yes, there is a lot that needs to happen to improve the system. Dr. Israel offered a few things, which he said is, look, just changing the reimbursements to get more psychiatrists into the pipeline would make a huge difference. And so, yeah, World Mental Health Day is just one day of the year, but it's an important opportunity to reflect on what we can do to help not just the Jessies of the world, but also all the other people out there who are suffering in silence. We need employers to offer great benefits like PTO and flexible work schedules. We need to fix the psychiatrist pipeline and reimbursement approach to get more mental health professionals into the system. And this is honestly probably just the tip of the iceberg. It's going to take all of us to make a difference. If you want to help, we'll list a few charities you can donate to in the description of this video. And if you're a mental health provider or an organization that needs help making care affordable for your patients, hit up Access One. You know where to find us, and we'd love to talk to you. We think we can help you make a difference for your patients when it comes to the cost of care, making it more affordable. Thanks. Peace.